Up next, how to use social platforms to inform your health. Joining us on the Global Black Economic Forum stage, board-certified psychiatrist and researcher, Manhattan Behavioral Medicine, Dr. Judith Joseph. Chief Executive Officer, Vituity, Imamu Tomlinson, MD. The CEO of the Influencer League, Brittany Bright. Pharmacist and self-care strategist, Dr. Alisha Reed. And physician, social media content creator, and advocate for health equity, Dr. Joel Burville.
All right. Welcome. Welcome. So I'm so fortunate to talk about the creator economy today. $110 billion a year is brought in by the creator economy. And AI is probably approaching the trillions, right? So we're fortunate to have experts in both on stage focused on healthcare, because most people get their health information online. But how do you know what's credible? How do you know what's noise? We're going to try to decipher that today. We're going to figure it out. So I'm going to start off by talking to my talented panelists and asking them to tell a story as to how they got into this space, into the creator economy and the AI space. I'll start with you, Dr. Tomlinson.
Yeah, so welcome. Hi, everybody. Thank you for having me. I think from our standpoint, being the CEO of a large provider group, we cared for over 14 million patients last year. And so finding patients and people isn't that hard, but we're only communicating and connecting them in one way, which is that physician-patient relationship, which, as you know, could be a very challenging and scary time. So what we're trying to do is change the way we interact. That's why we're here at Essence, that's why the Global Black Economic Forum, to really try to connect with people. I'd say the one story I have is I had a patient that came to me with everything they already knew from AI, everything they already knew from social media. I think probably Joel, everything they knew from what you told them. And so now my role changed from a person that was just going to give knowledge to a person that to help them facilitate their transition through care.
That's incredible. Brittany.
Hi, everyone. I'm Brittany Bright. So I'm in the creator economy. I am the founder of the Influencer League, and our agency exists to bring access to credible education, access to resources for Black creators and essentially underrepresented creators overall. And I got into this space through agency work. One of my very first clients through social media was local healthcare systems. Funny enough, the very first local healthcare system that I did social media for was in George County, Mississippi, which is a very rural county in Mississippi. So being a part of that work very early in my career, that never left me. And so as the career and as the agency evolved and as we grew and I did more work with, different industries, the healthcare industry stood out to me the most because it's one of the most regulated industries overall. But even through social media and the creators that we work with and the healthcare professionals we work with, we have to go through great lengths to vet creators and find them and find these healthcare professionals to make sure that the work that they're doing and the information that they're putting out does not lead their audience astray. And so a lot of that work is the intersection between a healthcare professional, a lifestyle creator like an everyday mom sharing that information, and how do we help audiences determine what that credibility looks like, how to find it, how to understand it, and what to do with that information. Just like you mentioned, someone, got educated by Dr. Joel, and then they came to you for the access to that. So that's how I got into that space.
Thank you. And Dr. Alisha is a pharmacist, and less than 7% of pharmacists in America are Black. Less than 8% of physicians are Black. We have 2 on the stage, well, 3, including myself. Less than 2% of psychiatrists are Black. So, Dr. Alisha, tell us about your work in this space.
So I've been a pharmacist for 23 years now, and I realized that most people do not know what a pharmacist does. They simply believe that we just count pills and dispense prescriptions and that's it. So a huge part of my content creation and showing up on the platform was to inform people about what a pharmacist does. And more specifically, be there as a black pharmacist, the pharmacist women trust, right? But it wasn't until I had my own health issues that I realized the importance of sharing the information on social media, because a lot of people go there and Google their symptoms and look at AI to find out what's wrong with them and self-diagnose. And I wanted to share that as not only a healthcare professional, I'm also a patient. And I think that's a dual lens and a dual perspective that a lot of people don't see. So I use my platform to share that. I was working during the COVID pandemic, which was one of the most stressful times of my life. I had lost my husband to a heart attack months before. So I realized my blood pressure was elevated, and I was like, in real time, I wanted to show my community, like, how am I doing this? I live in New Orleans, where we have an abundance of food. So I wanted to share what that actually looks like and try to dispel some of the misinformation at the same time.
Well, thank you for sharing your pain and being vulnerable and for helping people using that. And Dr. Joel Burvell, you are an award-winning content creator, but initially you were a medical student, learning your own education, and then that turned into a platform where now you educate millions of people. Tell us about your journey.
Hey everyone, my name is Dr. Joel Burvell. I'm a resident doctor, but I'm better known online as a medical mythbuster for creating videos about health inequities in medicine and the way that healthcare still doesn't serve all populations equally. So as Dr. Judith mentioned, I really started creating content about 6 years ago when I was a first-year medical student, which is wild to think about. But I started it because when I got to medical school, I realized that so many of the topics we were having in classes were things that I'd never heard about, but would be so powerful for myself, my mom, my dad, my sister, my brother, to have known about years ago. And so I took to TikTok, of all places, to really start breaking down healthcare disparities that existed in the field of medicine. And one of the first videos I made was about this device called a pulse oximeter. It measures what's called your blood oxygen saturation level, essentially how much oxygen is bound to your red blood cells. And I read a study that showed that in black patients, pulse oximeters are 3 times as likely to be overestimated and inaccurate, meaning that you could actually be short of breath, but this device would read normally. And during the COVID pandemic, that actually led to black patients being turned away from hospitals and not getting supplemental oxygen. It's been cited as a reason why more black patients died during the COVID pandemic. So I posted that video. I could only do 30 seconds at the time, and it ended up going viral, getting over 500,000 views in 24 hours. And from there, I started a whole series of videos called Racial Bias in Medicine, where I really broke down how medicine still fails so many black communities. So today, I've made hundreds of videos, built a platform of over 2 million people. But I think really, when we talk about AI, it's looking about the future. If we know that there is incorrect information that is still out there in our medical system, how do we make sure that patients that are using AI or the systems that are using AI to build the next generation of medicine isn't just rebuilding the junk that's in there and putting it forward as fact?
Wow, well, your story is so powerful, and it's an example of how you used your content to save lives. But you're right, there's so much misinformation out there, and now there are AI creators. But we know that AI creators have never experienced health issues themselves. They've never experienced loss or pain or real-life experiences, but they are a threat. And I'll bring it back to you, Dr. Tomlinson, because you run a massive healthcare organization. What are the positives and negatives of AI?
I think I'll start with the negatives. I like to end on an optimistic note. I think the negatives are the resistance of all of us to be able to dive into something. And I think to avoid it, which I would recommend that avoiding it is not the right model. You need to dive into it and figure it out. But the negative is it tested? Is it trusted? Is it interrogated? I have a license. I have to keep my license, whereas AI doesn't necessarily have that level of interrogation. So I think that's a negative, to just trust something empirically that's not being tested. The positive is it allows people like me to interact with patients in a whole new, different way. There were lots of tasks that I had before that were very difficult and very onerous, and I was spending time typing or spending time doing my charting, when now I can spend my time really interacting with somebody. The other thing I think it does is it really elevates, it gives agency to all of you. So now when you come and see me, it's not about the knowledge I can transfer, and I kind of said this in my opening, but it's really about how do we work on this knowledge together, how do we cross-check it, double-check it, and give you the power to tell me where I need to make your healthcare better, not me telling you what's good for you.
AI can't be they don't have a license, so, and they're not mandatory reporters. You know, in the work that I do as a therapist, if someone tells me something about trauma, I have to report it, I have to get them help. AI doesn't have to do that, right? And AI has this trend to essentially tell you what you want to hear in therapy, so it's a sycophant. But we can't run from it. 70% of our youth are using it as a companion. 40% and more are saying that they'd rather talk to an AI therapist than a real therapist. So we cannot afford to shy away from it. And I'll go back to you, Brittany, because you work with brands to work with content creators. And tell us about your work, you know, helping them to recognize that you can't replace real-life health professionals with AI.
It's really interesting because I'm in the process of building AI for the creator economy to help close the pay gap and help, you know, expand access to education for underrepresented creators. And the process has been interesting. It's taken me almost 2 years. It doesn't take that long these days to build AI. It's taken me that long because this is domain-specific AI that's built from knowledge and not from someone's data. And that's what is a huge concern with AI right now, especially in the healthcare spaces. What does data collection look like? Who's owning that data? Where does that data go? And how do you continue training that AI? And where does that training come from? And so I think that is a really huge disparity that a lot of people are not understanding just yet. Apart from the misinformation, what are you doing with that personal information that I'm giving it? But the other side of that is, what does adoption look like, especially when we're working with healthcare professionals versus, like I said, working with, you know, the everyday mom. That everyday mom is helping these creators, helping the audience, helping consumers with adoption of what your doctor told you, right? How do I take that home? How do I live with that every day? What does that adoption look like, especially with, you know, medical devices? What does continuing education look like? So AI has a place. It's just who's building it? Why are they building it? What are they doing with the information? And how do they continue to maintain it after it's built?
Well, I know one thing that AI can't build is community, right? But you, Dr. Alisha, you have really built communities, online communities and platforms to help others. Tell us about your work.
Yes, so I think it's important to be able to share your experiences. So when you share your lived experience and you talk about it, you get other people to start talking about their experiences. And it's from that, we build community, and you recognize someone may be experiencing the same symptom that you've experienced. So that causes that caused you to go see the doctor because you've heard, oh, that seems like what I was experiencing, rather than Googling something at 2 a.m. to figure out what it is and not really being diagnosed by someone. But I find that everybody is looking for interaction. You have AI there, but that's not a human being. So you want someone to communicate with. And we have people that are managing chronic health conditions alone. And this allows you to build spaces where people can talk about their challenges and share information with each other.
Information is life-saving, we know that. And Dr. Brevell, you're currently working in hospitals, likely using AI, but also trying to combat the misinformation out there. Tell us about your work there.
Yeah, AI is so interesting to me. So I'm going to tell a story really quickly about like the harms of it, and then go into the good sides of it too. So in most hospitals in the United States, there is an AI algorithm that's used to risk stratify patients when they go to the emergency department. Meaning, if you go to the hospital, it basically says, does a doctor need to see you now, or can they see you later? There was a study done by UCLA, and it actually showed that for some reason, when black patients had the same illness as someone that was non-black, they were less likely to be recommended to go see the doctor first. And so the researchers were like, why is that? How come that's happening? What they found out was the AI algorithm was looking at how much a person cost the healthcare system, as opposed to how sick that person was actually for the healthcare system. And so because we know that many patients that are from marginalized backgrounds or from rural areas don't utilize the healthcare system as much, it was a self-fulfilling cycle where it was making it harder for patients to be seen by doctors. The study actually showed that if the algorithm had actually been using it equally, black patients would have been seen 8 times more than they currently were. So that's to talk about the harms of healthcare. If we don't think about AI and the equity that needs to be built within it and the way that it doesn't serve all people equally, it's going to do more harm. But on the flip side, I see every day the ways that can be helping patients. I've had patients come in and say, hey, doc, just so you know, before I came in, I Googled my symptoms and I went to ChatGPT to ask you the right questions. And I actually love that because if they're able to narrow down the top 3 questions, I only have 20 minutes, 30 minutes, they can narrow down their top 3 questions that is most important for them to know to ease their concerns. That helps me better be able to use our time efficiently and be able to help patients out. But I always tell patients, not all AI is equal. Not all LLMs, large language models, are equal. In healthcare, we use one called open evidence. And so any healthcare professional will know what that is. But that's one that's actually sourced directly from things like the New England Journal of Medicine and PubMed and journals that are actually accurate, as opposed to something like ChatGPT, which doesn't necessarily source from those same exact resources. So all that to say that AI is being used every day by doctors, and I think the ones that are using it to better their practice, spend more time with patients, make sure we get quick diagnoses, and better explain things to patients are the ones that are doing better.
Yeah, I think that it's important to realize that there are positives and negatives, and I'm glad you brought up the fact that in some, especially in the Black community, underrepresented communities can sometimes be harmed by AI. And as someone who has a perspective that really, you have a very wide perspective of your corporation, the patients that you treat, tell us about ways that we as the Black community can utilize AI tools to improve our health.
Yeah, so just to give you scale, we take care of, I mentioned 14 million patients, but we're in 30 states. We're all across the country in multiple specialties. So we interact with a lot of patients and we see a lot of patients, what they're worried about, what they're scared about. What I would recommend for you all is to take control. And I said this yesterday, take control. Don't trust me, even though I have this wonderful face, right? Don't trust me. Don't trust even open evidence. Interrogate everything that you hear, because at the end of the day, you are uniquely you, and you don't want a plan, a healthcare plan that's just built for everybody. You want it built for you. So bring all the data to, whatever your pharmacist, to your doctor, bring all the data and say, hey, here, this is what I worry about. Then they can create a plan with you, and then you can decide if that's the right plan for you. So that's, I would just say, I call it agency, which is really taking control of your healthcare.
And that's really what personalized care is all about, right? Patient-centered. So you want to make sure.
And Brittany, you were saying that backstage that you really are intentional about placing Black health professionals with brands, because many times the rosters don't have any Black people. And your work really is bridging the gap. Tell us about that.
Of course. So there have been plenty of situations in my career on the agency side where we are given, we've gotten a new client in, whether it's healthcare, whether it's beauty, whether it's, home decor, whatever. When you're working at these agencies, you get used to being the only Black person in the room. You're the only Black person who is not having to think about diversity as a second thought. It's your lived experience. So you clock it immediately. And so there was a situation where we were working with some healthcare professionals and we were working with a brand. And the purpose of this campaign was wearable healthcare. And we were working with healthcare professionals, tech influencers, and lifestyle influencers. So there's this mix in the strategy because different messaging coming from different places is going to breed different results with social media. With healthcare professionals, it's more credibility. You can feel more comfortable trusting it. Whereas with tech influencers, you understand how to wear it. What is the, specifications? What are the, details that you need to understand about wearable healthcare? And then the lifestyle creators, they're the ones who help that adoption. It's the relatability. It's okay, this person looks like me, like this looks like my neighbor. I trust this a little bit more. So you need that mix in there. However, when we're working with the healthcare professionals, these rosters are incredibly white. And so it's, I can't send this over to the client We have Dr. Joel, we have Dr. Judith. There are many examples of healthcare professional creators that we could activate. Where are they? And interestingly enough, the tools that we use to source and find creators, they use AI. It's driven by AI, and it's not showing those results. So it's now a matter of, okay, I have to get out of these tools, and now I have to comb social media for healthcare professionals who are active, who are sharing information. We're reading their comments. It's not about how many followers they have. It's never about how many followers they have. That's incredibly important for people to understand. When we're working with healthcare professionals, followers and engagement doesn't matter. What matters is, are they credible? What are they currently doing? Where are they currently working? What type of patients do they see? If you're reading their comments, what's the feedback they're being given from their audience? Are they controversial? So we do expanded vetting. And so for us to have to go the extra mile, it's worth it, because with social media, especially I'm from Mississippi. Living in Mississippi, Alabama, Tennessee, Louisiana, you understand what rural life is like and what access to credible healthcare information through social media needs to be. And we need people who look like us giving out that information. And so that is a large part of the work we're doing on a daily basis is, although we're not the doctors, we have to make sure the doctors are the ones being seen as the influential people on social media.
Well, thank you for what you do, because I tried to look at the data on how many creator agencies there were that were Black-owned. They don't even have the data yet. So thank you for what you do. And I can tell you, the creator economy is $110 billion. And most of my large partnerships, there was always a Black woman behind the scenes. So thank you. And that leads me to you, Dr. Alisha, because you were saying that you were just at the very first Food is Medicine conference. And you were telling me about how cultural competency is so important when talking to Black communities about things like food, medicine, and diets. Tell us about your work there.
So I had the opportunity to attend the Food is Medicine conference because I serve on an American Heart Association Patient Lived Experience Board, Advisory Board. And we were able to talk about how using food as medicine, however, while also recognizing that there's cultural issues, right? I live in Louisiana, New Orleans. If you're here, I know you've had a chance to taste all of the wonderful food that we have. You see a physician and they talk to you about the DASH diet and tell you to limit salt, and then you have it's crawfish season. So a lot of the conversations were about how do we include this population of people, and how do we talk to them and include them in this data and see what their concerns are. So it's more about building community, and then also allowing patients to have a say in their healthcare.
And Dr. Joel Burrell, we're both a part of the Harvard Creator program, which is really trying to get healthcare professionals online to combat misinformation, or else we're going to be replaced. Yeah. It's not a matter of if, it's when. So tell us about your work, really advocating for health professionals.
Yeah, so as you mentioned, we're both working with Meharry and Harvard University. They put together this creator universe where we're talking about how do we get more healthcare professionals online right now. And for me, I think about the fact that misinformation and disinformation spreads faster than accurate information, unfortunately. And if we really want people to have good information that about healthcare that is accurate and actually can help their lives, we need to be meeting them where they're at. Right now, 6 in 10 Black Americans use social media in order to get health information from online. And a Pew Research study just came out yesterday that showed 50% of Americans just overall get their health information from online. And it's only increasing as things like ChatGPT and other areas become more prominent for people to ask for health advice. But the thing that we need to realize is most of the advice out there is incorrect, especially as this wellness space expands. Supplements are talked about often, but there's individuals that have no background or no training in medicine at all, talking about these different topics, trying to sell something. And so for us, for me, it's really about how do we make sure that we flood the internet with accurate information. That takes us being on there. That takes all of us in the audience right now understanding what is accurate in information versus what is misinformation. Being good stewards. I think back to like my English class with Mrs. Russell, where she taught us how to understand pathos, ethos, and really understanding why advertisers are putting things out there, what drives the incentives behind a social media site like Instagram, which is views. And if I could do one thing different on social media, it'd be to raise accurate information higher than information that's just inflammatory. Unfortunately, we're not there yet, so it's up to us to make sure that when we see misinformation, we call it out, we report it, and that we try and make sure that we put more accurate and share accurate information out there.
Yeah. And I'll end with one word for the future of health information online. It's a quick question for each of you.
One word?
One word.
Optimistic.
Hopeful.
I'm going to say discernment. Discernment.
Unbiased.
And I'll say essential. Thank you so much. Give a round of applause to our wonderful panelists, our experts.